like to start asking you some questions regarding your food intake, lifestyle, and a glimpse of your day-to-day activities.
All right, sounds good.
So, how old are you, Mr. Brown?
I'm 75 years old.
Okay, regarding your food intake, can you describe what you usually eat for breakfast, lunch, and dinner?
We often go out for breakfast or lunch, and most nights we either go to a seafood or Italian restaurant. I usually eat bacon, eggs, and usually toast, and usually a coffee with a creamer. And sometimes I pick out donuts at my favorite bakery across the street.
Yeah, we really like eating out.
That's good. What if I ask you about favorite foods or like special dishes that you like to eat?
My favorite dishes are typically fried with cream cheese or cheese sauce.
We often order some Caesar salad as well.
Yeah, but I don't really like vegetables.
And when you eat at home, what do you usually cook?
I sometimes have a meat sandwich and usually a Coke. My wife's a great cook and she often bakes like a lot of sweets that I like to eat.
That's great. Okay, now regarding your day-to-day activities, do you do any exercise, hobbies, or activities that you like to do day-to-day?
We retired about 10 years ago. So since October, from October to April, we go to Florida and we live here for the rest of the year in Indiana. We really enjoy spending time on the beach and like reading or playing cards with friends, but besides that, we don't really do much more physical activity.
That sounds relaxing.
Yes.
What about exercise? Do you like running, biking, cycling?
So I have knee problems, so we exercise occasionally, but most of the time I stay at home because my knee hurts.
Okay. Okay, so I believe I'm done with some questions. What about we go ahead and take your blood pressure, weight, and height? You can follow me, and then I can ask you to take your shoes off if you don't mind.
Okay, sounds good.
Great. Has your blood pressure been this high always?
Yeah, my doctor's been watching for the past 5 years, and it's increased over the couple years, unfortunately.
I see.
And we really want to make some lifestyle changes before he needs to take some medicine to control his hypertension.
Okay, so by looking at the assessment, we could totally do that. According to what we talked briefly about your food intake, day-to-day activities, and exercise, it seems that you can lower your blood pressure levels by doing some food changes and actually lifestyle changes. So right now your pressure is 139/85, which is under the category of hypertensive. I would like to recommend trying some foods as fruits, vegetables. I know you don't like vegetables, but you could try other ones or maybe some different cooking methods. How does that sound?
Is he have some nutrient deficiency?
Well, it appears that he has deficiency in fiber, folate, iron, calcium, potassium, and vitamin C and vitamin A. If you increase the consumption of vegetables and fruits, the vitamin A part should be fine. You don't even would need supplements if you increase the fruits and vegetable consumptions. I would also recommend stopping drinking regular Coke and try Diet Coke to decrease the calories. And then, of course, if you can decrease the eating outside and just maybe cooking some meals. You said you like cooking?
Mm-hmm.
So you could increase cooking meals. That should totally help with the lowering your blood pressure levels.
Yeah, it sounds really good. What is some other supplements that I can use to fortify his diet?
So as of right now, the only supplements I would recommend is calcium, vitamin A, and vitamin C. But if you increase your vegetables and fruit intake, that should be fine.
That makes sense. Thank you.
Okay, so it also seems that you're already low in iron. So I would totally recommend to increase and take enough vitamin C. That should basically increase your iron absorption, and then in long term, that should prevent osteoporosis.
Okay. That sounds like a lot, but I think I could do it because I really want to avoid taking medication.
I believe in you, Mr. Brown. Regarding physical activity, I would recommend to at least do 2 hours and a half per week. I know you have a knee problem, but we could talk about with our exercise specialist about different exercises, like instead of running, just do bicycling or something. So I don't know if you guys want to take a look at the ideas and advices that he has.
All right, that would be great.
Okay. So before you get a chance to talk to him, I just want to remind you guys that it is very important to choose dishes in low in saturated and trans fats, and then try to choose dishes rich in protein, fiber, calcium, and potassium. These changes should totally lower your blood pressure levels in a few weeks, and we can try to keep controlling your hypertension without taking any medication. So you should be fine.
Okay, thank you so much. We really appreciate it.
Okay, so what about you guys follow me and then we can talk to the exercise specialist.
Sweet.
Okay, so regarding your physical and nutritional health, what are some concerns you have and also some improvements you're seeking to make?
So I've been diagnosed with hypertension due to my high blood pressure, and my diet isn't necessarily the best. I have a couple of deficiencies and a couple essential nutrients that I should be getting, and I live a pretty sedentary life. I retired recently, and I don't really get much physical activity, and I have a knee injury that kind of prevents me from doing a lot of things.
Okay, awesome. Yeah, so I mean, the first step to tackling any sort of health problem like hypertension is having drive and motivation to do so. So it seems like you have that. So first off, with addressing your nutrition, there's a few resources at your disposal. I know Dr. Zaid talked about some lifestyle diet changes already, so I'm not going to really go into the details of that, but I do want to let you know of like some resources out there, online resources such as MyPlate, Super Tracker, and the DASH eating plan. All these resources help you figure out a nutrition plan that best fits you and then helps you track it as well. So now when it comes to your physical activity, I'm just going to suggest a few different resources. One of the big ones being Silver Sneakers, which you can find at many of your local gyms if Silver Sneakers is at those gyms. If not, you can always partake in water aerobics or spin cycle classes at different gyms like that. You know, it really it'll get your physical activity up. Anything will, walking, whatever, and hopefully keeping strain off of your knees. And so I know there's a lot of information, but I'm going to walk you through it all. So does that sound good?
Yeah, sounds good. I will monitor he's doing that.
For sure, yeah. So
Sounds good.
let's get started then.